Fabulous. So I think we'll make a start now. We've got a very tight schedule for you today, so hopefully we'll have time to get through all of our fabulous speakers and panelists. So a very warm welcome to day 3 of our Youth Mental Health and COVID-19 conference, which is brought to you by the UKRI Emerging Minds Network and the ESRC Centre for Society and Mental Health. So I'm Dr. Helen Fisher. I'm a reader in developmental psychopathology at King's College London, and I'm really delighted to chair the session today, which will include 10 minutes, hopefully, talks from 7 fantastic speakers, followed by a panel discussion including carers and a young person. So we're really looking forward to hearing their views as well. And the question we'll be addressing today is how will the social and economic consequences of COVID-19 affect young people's mental health in the short, medium and long term? And really we're hoping to think about some of those challenges, but also particularly the opportunities that presents us to help young people thrive going forwards. So I'd like, as I said a little bit earlier, to invite audience members to post in the chat and introduce yourself so we know who's listening today. And Mental Health will be live tweeting throughout the event, and we'll be posting a tweet in the chat so you can share that on your social media if you'd like to. Please also do feel free to tweet about the session using the hashtag YouthMHCovid. As I say, after the speakers we'll have a panel session and we're going to be using some pre-submitted questions, but if you'd like to ask a question for clarification during the session, please do use the Q&A feature and we'll try and answer as many of those live as we possibly can. If our speakers are happy to be contacted to answer any questions they're not able to do today, please, I'll invite them to put their contact details in the chat so you know how to access them if they're happy to chat with you. These webinars have been extremely popular. It's great to have so many people interested. If you find that you've got colleagues who can't join us, please do let them know that the event is being live streamed on the Mental Health YouTube channel. I think the link is being posted in the chat for you. And these videos will be available on that channel after the event, along with presentations, which will be available with the links to the videos on the Emerging Minds website and the Centre for Society and Mental Health website. We're also really excited to have Freya with us, who's a young artist from Fully Focused Productions, an amazing youth-led media organisation, who's joining us today to create some illustrations of the key themes from the presentations and panel discussion, which we'll be sharing afterwards. So I'm certainly looking forward to seeing those. Finally, and really importantly, we're obviously going to cover lots of potentially sensitive topics today and potentially distressing issues. So if you feel unwell or unsafe at any point during the webinar and you'd like to talk to someone confidentially, then please do send a private message to Jo in the chat, who's helpfully changed his name there on the handle to Jo Help and Support Message Me. So please do reach out to him if you need to. Okay, so let us get started. Now I've gone through all the blurb. Really lovely to see you all, and we're really excited that our first speaker is Professor Sir Michael Marmot from UCL Institute of Health Equity, who is going to talk to us today about social justice, health equity and COVID-19. So Sir Michael Marmot has been a professor of epidemiology at UCL since 1985 and is an advisor, amongst many other things, to the World Health Organization Director General on social determinants of health. So I'll pass over to Michael for his talk. Thank you.
You're muted, Michael. Can you unmute for us, please? Thanks.
Do you think after 12 months I'd remember to unmute? Some sort of mental decline. I produced I think what I learned is I make as much sense when I'm muted as when I'm unmuted. So I did produce 2 reports last year. In February, before the pandemic, we published Health Equity in England, the Marmot Review, 10 years on. So 10 years after my Fair Society, Healthy Lives publication. And then because of the pandemic, I couldn't wait 10 years. 10 months after that publication, we produced Build Back Fairer, the COVID-19 Marmot Review. And the Build Back Fairer is very important, I think. My argument is based on the idea that health tells us something fundamental about how well society is functioning. And mental health is a key component of that. If society is not working, people's health suffers and their mental health suffers. And inequalities in society lead to inequalities in health, including mental health. And what I reported back in February was a rather distressing health picture. Life expectancy had stopped improving. Number two, inequalities in health were increasing. And number three, life expectancy in the poorest areas outside London was going down, getting worse. People were getting sicker. We couldn't document the changes in mental health the same way we could look at life expectancy. But during the pandemic, where we saw the increase in inequalities, a striking feature was an increase in mental health problems, particularly for young people, particularly for young women. And of course, an increase in domestic violence in calls to police. In labeling my second report, actually, there was a third report that we did, which I think is important, which we called Sustainable Health Equity. It was showing how actions to improve health equity could contribute to net zero greenhouse gas emissions. And in thinking about building back fairer, the first thing to say is what the situation I documented in February 2020 was far from ideal. For the reasons I've said, health had stopped improving, health inequalities were getting bigger, and health for the poorest people outside London was getting worse. We do not want to go back to the status quo. I published a review in The Lancet 10 days ago of Michael Sandel's The Tyranny of Merit. And it chimed with what has been concerning me. Sandel picked up Michael Young's 1958 book, The Rise of the Meritocracy, and said that what we've done as a society is allow people at the top to congratulate themselves. The hubris of being successful. I did it. It was my brilliance, my hard work that got me where I am, and I deserve it all. Now, to the extent that we buy into this, it means that people who didn't make it to the top have got no one but themselves to blame. What a terrible state of affairs. We reward people at the top disproportionately, and we invite people who didn't get to the top to blame themselves for their lack of success. Think about what happened during the decade from 2010, where I've documented that health inequalities increased. Do you remember the language that government was using of skivers, shirkers, and strivers? There were shirkers and strivers, this Manichaean divide. The shirkers were leading a comfortable life on welfare, and the strivers were the so-called hardworking families. And it was very clear that the shirkers did not deserve anything from society and had only themselves to blame. How many people have you heard blame poor people for their poor health? If only they followed our advice about drinking and smoking and eating And the implication is, and being depressed. Pull your socks up. Don't get depressed. Behave properly. It's your fault that you are where you are. Well, not only empirically is that false. For example, if you look at people in poverty, the majority of people in poverty, the majority, are in households where at least one adult is working. They're in poverty not because they're feckless or lazy or irresponsible, but because they're lowly paid. But the whole ideology of the meritocracy invites people to blame themselves for their poor position in life. What does that do to people's mental health? So we're compounding the objective problems of inequalities, social and economic inequalities, that give rise to mental illness. We're compounding those objective problems with the invitation to people to blame themselves for their poor position in society. That's what the meritocracy is telling us. Do you remember all the way back to Thursday evenings in the first lockdown when we went out to applaud NHS workers at 8 o'clock in the evening? Some of us, maybe not enough, were applauding workers in social care. Did we also think about the delivery drivers, the people at supermarket checkout counters, the food processors, the refuse collectors, all the people that keep society functioning? These are people we treat as the unsuccessful people in society. We pay them poorly. We don't give them proper job structures. They're part of the gig economy, all of which damages mental health. And then we invite them to blame themselves for their position. Building Back Fairer has to recognize the vital role that everybody plays in keeping society functioning and creating the objective conditions that are going to make a difference. I was talking to a group yesterday afternoon, a European group, about evidence. And I used the example of adverse childhood experiences. I said it's highly likely that exposure to adverse childhood experiences increases mental illness and physical illness later in life. But even if we did not have that evidence, we can create a compelling argument. We know that adverse childhood experiences follow the social gradient. The more deprived, the lower the income, the greater the frequency of adverse childhood experiences. We also know that the positive side of early child development, nurturing for children, follows the social gradient the other way. There's less good nurturing of children the lower you are in the hierarchy. And all of that is going to be key to developing good mental health and good physical health later in life. And it's one of the problems that comes with increasing poverty and deprivation. I think the evidence base is clear enough that it's got to be an important part of how we create and promote better health and greater health equity in the future. And we know, as others on this call know better than I, that at least half of lifetime risk of mental illness begins by the age of 14. And the time to start is in early childhood and to continue throughout life. The stakes could not be higher. We need to create equity of health and well-being by building back fairer. Thank you.
Fantastic. Thank you so much. Such an important point to start our conference on, and just amazing framing for all the things that we need to think about going forwards and all the issues that we know children and young people are going to have to deal with depending on their current situation, but also what we need to support them with going forward. So thank you so much for opening us today. Okay, so I'm going to move on to our next speaker, who's going to think a little bit more for us about how these issues are going to affect young people during and after the pandemic. So I'm going to pass on next to Dr. Golo Henseke from the UCL Institute of Education, who's going to talk to us a bit about young people's assessment of the short, medium and long-term individual consequences of the COVID-19 crisis. And Golo is an applied economist and with a multidisciplinary social science background, and is leading a really exciting ESRC funded project exploring the pandemic's consequences for youth employment, learning and well-being. So I'll pass over to you.
Thank you, Helen, for having me. As of this very strong introduction, yeah, I'm hoping to add something that's also meaningful for our audience. So I think I'm going to look at a little bit at the health crisis consequence for young people's current and future well-being, and then invite some thinking about what are the questions that we still need to answer to better understand and help young people, especially looking forward, future well-being and maintaining optimism in this challenging times, especially how this then intersect with pre-existing inequalities. So I had a brief look at what has happened to youth employment in 2020. And despite the job retention scheme, there has been changes in employment. As predicted at the start of the crisis, youth employment has been hit harder than employment in other age groups. Young workers were more than twice as likely to work in lockdown industry at the beginning of March 2020, and about 3 times more likely to be in potentially precarious employment than workers above 25. And among others, the Resolution Foundation and others have shown that a lot of young people were hit by furlough, by reduction of working hours and so forth. There has been major changes there going on. Workers under 30 have seen their hours cut harder, express greater job tenure insecurity, and were more than twice as likely as prime age workers to actually have lost their job. The chart in this slide documents the drop in the employment rate for young people and young people who left education recently, especially, where you see this drop of about 6 points if you compare to the previous years. Furlough has certainly helped to prevent a hike in youth unemployment rates, like compared with the situation that we saw in Canada or Ireland, where unemployment was about 20%, like 1 in 5 young people were unemployed in September 2020. In Britain, the unemployment rate of young people has actually changed very little. What has changed, though, is who is in employment. The burden fell, especially, as I said, on education leavers, recent education leavers. I think some have called them the COVID cohort or COVID generation that's been hit especially by this at a sensitive point in time by this crisis. For those, employment rate dropped by about 6 percentage points from a baseline of 72%. And if you compare this with what happened in the Great Recession, like in the beginning of the Great Recession, the first 2 years, actually the changes that we see are quite substantial. They are larger, they're sharper, and this is just employment. It's not about the amount of hours worked, which have dropped even further. So there's been huge changes on the labor market in 2020, young youth employment across the board for that year. What we also know is kind of what happened to well-being over this period. The drop in the worsening or deteriorating of youth employment has been accompanied by big changes in psychosocial well-being, including life satisfaction, happiness, levels of depression and anxiety. I'm using here graphs from the UCL COVID-19 social study that fields an ongoing survey, reports weekly weekly since the beginning of the crisis. The graph shows substantial shifts over the last year. If you look at the trend at the beginning of 2020, with the country in third lockdown, we see that in January 2021, life satisfaction remained the lowest it has been in the last 9 months, and was similar to what it was at the start of the first lockdown in spring 2020. So social isolation is definitely taking its tolls. Levels deteriorated from August to mid-January, and this has occurred across age groups, but with adults under the age of 60 having persistently lower levels of life satisfaction. The gap is even, if you look at the curve for young people, it's even worse. Despite some increases in the last month, seen across all age groups, life satisfaction remains lower than during the summer, and they remain persistently lower for young adults. And this is life satisfaction. The same applies for happiness. We see also higher levels of depression and anxiety throughout the COVID crisis. Apart from that, the levels are remarkably low. Other studies show similar trends over time. One of the things at the same time, since the first lockdown in March 2020, people have been very concerned about financial adversities, such as the risk of unemployment or being able to afford make ends meet. Young adults are the most worried about financial matters, as are others from ethnic minority backgrounds and people living with children. These worries are persistently high and reflect a great level of economic uncertainty and uncertainty about future planning. These worries do not seem to correlate much with whether we are in lockdown or not. So these worries might be part of the explanation why we see such low levels of well-being. And we think in our project that there needs to be we need more robust evidence on how these economic worries intersect the contribution to well-being or intersect with well-being, and factors that allow young people to shape an optimistic view about their future. So these are some of the questions we like to shed light on in the following months. Specifically, we're interested in this intersection between resources, current well-being, and future planning and optimism. First of all, want to better understand what are the perceived scarring effects from the crisis on expected well-being and career planning. Scarring effects are often framed around lost lifetime income and greater risk of unemployment or greater risk of being in need. But the effects are likely to go beyond economic circumstances. There are potential reciprocal association between economic uncertainty, well-being, optimism for the future, and career planning, which might intersect with the pre-existing inequalities that we know exist. Then, what are the consequences of the crisis for young people's learning and job skills for the future? If worries about careers and skills are concerns, we need to have more robust evidence on how well career support and guidance reaches young people during this period, especially when services operate face-to-face. Moreover, the lack of opportunity for work-based skill acquisition, is likely to be a major part of employment scarring. But in addition, the training of young people already in work may have been affected in unpredictable ways. Specifically, we want to know how the volume and quality of training and education are changing in the pandemic and associated recession, and what socioeconomic groups and regions are most affected, and what are then the consequences of this on well-being, current well-being, and future planning. Such findings can inform an assessment of how well systems of education and training for young adults have held up under the current circumstances, and what is required to shore them up in the near future and in the recovery that follows. Finally, it's also important to think not just about how empty the glass is, but also look at who are the young people who actually can remain optimistic despite the challenges, which are the factors that increase resilience and young people's future optimism. And finally, how important are worries about careers and skill development and shaping young pupils count well-being and optimism. For example, if you think about job skills development, the same that I said about training holds also for the provision of access and to internships and other student knowledge exchange activities. With vacancies down and work being carried out remotely, it is conceivable that for many young people, it was harder in 2020 to find internships. It's also of interest to map how education providers are stepping up and developing alternative forms of student knowledge exchange activities to complement the market-based in-person internship provision, which are mostly organized by employers and as a result of the crisis, substantially curtailed. We think this matters because if the question how worries about skill development and careers shape current well-being beyond the social isolation and the consequences of direct lockdown, the policy implications, of course, will differ. If well-being is and optimism is most linked to COVID containment measures, we can expect improvements soon. Okay, am I reaching the end? But if it's voice about career opportunities and skill development, much more needs to be done. In our project, we aim to shed some light on this. Data collection is commencing, and first findings will be out at the end of March after Easter as the Lakes research report. And if you are interested, want to know more about the results, please get in touch under this email. Thank you.
Perfect. Thank you so much, Golo. And sorry to cut you off in
no, that's
prime.
fine.
And please do, if you want to put those in the chat for people to be able to access as well, that would be great. Thank you so much for that talk. Really useful to think about the different issues that young people are facing and how difficult it can be for them going forwards, particularly in terms of being able to access internships and other types of experience and gaps on CVs, but also the opportunities there for them to thrive and develop resilience. So lots of things for us to think about, and we look forward to hearing how that study progresses. Do keep in touch. Great. So we'll pass on to our next speaker then, who is Dr. Jo Inchley from University of Glasgow. He's going to present on social inequalities in adolescent mental health and school experience. And Jo is a behavioural scientist and public health researcher specialising in child and adolescent health. So Jo, I don't know if you want to share your slides with us. Is Jo there? Yep. Hi Jo, you okay there? You're right to share your slides and get started?
You're muted at the moment, Jo.
Oh.
Sorry, Helen, my internet connection just went down. I apologise. Are you ready for me to start screen sharing?
Yeah, if you're ready, that would be great. And just a quick welcome to Sally. Lovely to see you. We'll come back to you in a bit. Go for it, Jo.
Sorry, Helen. Can you hear me now?
Yeah, can, yeah. Do you want to have a go at sharing your slides?
It looks like Jo's internet connection is a bit flaky.
Okay, so should we? Do you want us to come back to you, Jo, in about 5 minutes or so? Is that all right? Should we go on to the next speaker? Is that okay?
Yes, please.
So in which case,
yes, please.
Move on. Yeah.
Thank you.
Okay. Great. All right. So we'll move on, if that's all right, to Professor Cathy Creswell. If Cathy is ready. He's from the University of Oxford. He's going to talk to us about interventions to address common childhood emotional and behavioural difficulties in the context of COVID-19. And Cathy is a professor of developmental clinical psychology and honorary consultant clinical psychologist doing just amazing work in this space and in youth mental health generally. So I'll pass over to Cathy. Thanks, Cathy.
Thanks so much, Helen. Can you see my screen okay?
Yeah, that's perfect.
Lovely, thank you very much. So obviously our question today is really about how the pandemic will affect children and young people in the short, medium and long term? And I think the answer to that, of course, has to be, well, it depends what we do now. And we've heard a lot about the wider social context and how important that is. And also in this session, we're hearing a lot across the talks. We'll hear more shortly about adolescents and the particular challenges they face. So I'm going to particularly focus on younger children now, and particularly thinking about how we can get support to children and families who may be struggling at this time and going forward. And so I'm really going to be talking to you about some work in progress that's been developed very rapidly to address some of the needs that we've seen during the pandemic. So just as a recap on this, so on Monday, if you joined us, you will have heard a talk from Tamsin New Love Delgado from the recent Mental Health of Children and Young People in England survey that was conducted in July 2020. And the headline figures from that were that back in 2017, when the study was last conducted, 1 in 9 children and young people were found to have a probable mental health disorder. And at that time, we saw a 49% increase in emotional disorders in children and young people since the survey that was conducted in 2004. So we already clearly had grave concerns about the mental health status of children and young people in England from this data. Then when this was conducted again in July 2020, the numbers had increased. So we saw 1 in 6 children and young people had a probable mental health disorder. And in this talk, I'm going to be focusing particularly on primary school age children. And I think it's notable that in that study, actually similar increases were found from 2017 to 2020 in both those younger age children, the primary school age group, and the older participants in the adolescent age group. So you can see here that among the 5 to 10-year-olds, quite a substantial jump in probable mental health problems in the primary school age group. And actually, this was particularly accounted for by boys and an increase in attentional and hyperactivity type problems at that time. Now, this has been very much mirrored in the findings that we've had from the Coast-based study, which you also will have heard about on Monday in a presentation by Polly Waite. This is not a representative sample. However, what it has been able to do is to track children and young people's mental health symptoms on a monthly basis over time. So look at how things have changed amongst study participants and for whom they've changed. And as you might remember from Monday, essentially we've seen that at points of the highest restrictions, we've seen increases in behavioural problems, emotional problems. If you look at the yellow line, that's your primary school age group, and particularly the same pattern that we just heard about in the national survey: restlessness, inattention, hyperactivity type problems. So the yellow lines here are your primary school age children, and across all of these areas you can see that problems increased gradually over the period of the first period when most children were learning from home. Things seem to improve a bit after that, but we've been seeing a gradual increase again, and we've seen significant shifts in the last month. Here you can see up to January, we've just been looking at the February data, and actually some of the findings are quite stark in terms of really seeing peak levels of problems when we look overall among our sample. And that also is reflected when we look at the numbers who meet criteria for possible or probable caseness of mental health difficulties. So again, your yellow line shows you the numbers of children and young people meeting those criteria, which means they've got a level of symptoms, but also the symptoms are causing interference in their day-to-day life. So again, you could see that the yellow bar in all areas, numbers of potential cases increased up to June, then decreased after restrictions eased, but we've also again seen this increase in all areas over the recent lockdown period. And that's been also very much mirrored by the experiences of parents and carers. So we've looked here at depression, anxiety and stress, and you can see particularly that levels of stress and symptoms of low mood and depression have been particularly heightened at times when restrictions have been at their highest levels. And in keeping with what we've already heard, those were particularly the case for parents of primary school age children who have been struggling, but also for families facing other challenges, single adult households, low income families, and parents of children with special educational needs and neurodevelopmental disorders. So we really need to be thinking very hard about how we support those families who've been struggling, who are struggling now and may continue to struggle. So I just want to tell you about a couple of things that we've been doing to try to rapidly address this. And the first is a study that's being led by Professor Edmund Sanuga-Bark at King's College London. And here are the part of the team who are doing a lot of the work on the ground. And this study is called the Sparkle Trial, Supporting Parents and Kids Through Lockdown Experiences. And essentially, the team have very rapidly worked with parents and our tech partners to develop an app for parents. And this has very much reflected some of the things that parents are telling us they would find useful at this time. So the app provides information for parents through what's called the Parenting Booster session, where parents can see short animations, videos, graphics, texts. They can also access peer support from other parents, again, something that parents have highlighted as being really critical and actually has been really challenging over the last year, and a wider set of resources through a parent information hub. So this is all up and moving along quickly, and we'll be shortly launching the trial. And the exciting thing is that because we've had the CoSpace study going, we're embedding this trial within the CoSpace study to make us to allow us to run it really quickly and recruit families very efficiently. So we'll be randomizing participants in the CoSpace study who want to take part to either the Parent Positive app or follow up as usual, that's FAU, and then we'll be following them up 1 and 2 months later to see how their children have got on. And we're really hoping that we'll be able to see some improvements in relation to the difficulties that we've seen faced by parents of primary school age children. Now, that's very much aimed at a sort of a public health level approach to support those who are experiencing challenges in their day-to-day life. But obviously, many families are going to need more support than that. And we know from before the pandemic that access to child and adolescent mental health services was very limited and also very variable. So here there's some highlights from the Children's Commissioners from England's report from January 2020, which looked at the state of children's mental health services and really highlighted the variability and often very long waiting lists encountered, the tiny amount of expenditure in children's mental health in some areas, and certainly relative to adult mental health, and the huge variation from region to region in terms of accessibility of services. And you'll remember that we saw increases in difficulties in all areas, and the Sparkle work's very much focused on these more behavioural problems. So when thinking about CAMHS, we've been particularly thinking about these emotional problems. And in primary school age children, we know that emotional problems are often characterised by anxiety problems. And the good news here is that we do have treatments that we can deliver efficiently and effectively. So in the past, we've conducted studies where where therapists have supported parents to help their children to overcome problems with anxiety using a cognitive behavioural therapy approach. And essentially what we've been able to find is that we can achieve really good outcomes, so almost 80% much or very much improved, but straight after only 5 hours of an intervention, which is much shorter than our traditional psychotherapies, by supporting and empowering parents to be able to help their children. And we've also demonstrated that this is both clinically and cost effective compared to an alternative brief psychological therapy. So we recently have worked extensively with parents to adapt this into an online programme. So when the pandemic came along, this obviously provided a way for us to provide brief, accessible, efficient support remotely in the current context. So we're currently conducting a trial called COCAT, which is going on around England. We've got teams from Devon to Northumberland. And this is a randomised controlled trial comparing the clinical and cost effectiveness of this online guided parent-led cognitive behaviour therapy approach for child anxiety to whatever CAMHS are doing in the current context. And we're really delighted to have 43 NHS and local authority sites, over 250 clinicians trained up and raring to go, and already over 100 participants taking part. So we're hoping that the current context will allow us the opportunity to conduct this trial really rapidly so that we can get these findings out quickly, because there really is an absolutely critical need for evidence-based, efficient, accessible, and so to get all of that creatively co-designed solutions to make sure we can address the needs and overcome the barriers faced by families in accessing mental health support now and in the years to follow. So, thanks very much.
Thank you so much, Cathy. Such important work that's happening there, and really great to see what you're already doing and what more is to come in that really important space. Great. So we're going to pass back to Dr. Jo Inchley now, hopefully from the University of Glasgow, who's going to present on social inequalities in adolescent mental health and school experience. And Jo is a behavioural scientist and public health researcher specialising in child and adolescent health. Thank you, Jo.
Thanks so much, Helen, and apologies to everyone for problems with my internet. I'm really hoping, keeping fingers crossed, we'll be okay now. So thank you for my presentation. I'm going to go back a little bit in time to focus on young people's adolescent mental health and school experience and inequalities pre-pandemic, to really help us think about what the implications are for COVID and the longer term recovery from COVID going forward. I want to start with a quote, first of all, which was published in the BMJ editorial last week, which says, "Children have the least to gain and most to lose from school closures. This pandemic has seen an unprecedented intergenerational transfer of harm and costs from elderly, socio-economically privileged people to disadvantaged children." And we know that school closures have been hugely disruptive to children's learning, but also to their social and emotional development, to their engagement, to their levels of motivation, to the mental health. And what's particularly worrying, I think, is that many of these impacts may have particular impact in the long term on children who are already living in challenging or disadvantaged circumstances. And they may be the ones who take longest to recover. So I think that will be some of the discussion that we'll be having later on. And I know disadvantage means many different things, and I want to focus my talk specifically around socioeconomic disadvantage today, but bearing in mind that there's many young people who are at increased risk of mental health, ill health or poor mental well-being as a result of different circumstances that they live in. But today I'm going to focus very much on socioeconomic disadvantage, as I said. And I want to present data from the Health, Behaviour and School-Aged Children Study, HBSC, which started in the 1980s. So we have data going back almost 40 years now, and it currently includes over 51 countries from Europe and North America. And HBSC collects data from 11, 13 and 15-year-olds every 4 years, and it's a school-based survey. And it's unique in allowing us really to position young people in the UK within a wider context and understand how young people's experiences within the UK compare with those of adolescents who are growing up in other countries across Europe and North America. So within HBSC, we measure socioeconomic status using something called the Family Affluence Scale. So it's quite hard to measure socioeconomic status in research with children and young people and to find appropriate methods. So this scale was developed to enable us to do that effectively. And it's a child-friendly composite measure of material wealth within the home. And we ask young people about 6 different aspects within the house. So car ownership, whether they have their own bedroom, how many computers are in the house, how many family holidays they've had, whether there's a dishwasher at home and how many bathrooms. And that's used to create a composite index of relative rank at country level. So we have a measure of relative inequality within a country. So that's what I'm going to be talking about today in presenting some of the findings from HBSC. And the data come from the last survey, which took place in 2018. This is the international report, which was published last year, Spotlight on Adolescent Health and Wellbeing, and that's available to download from the WHO World Health Organization website. And in Spotlight on Adolescent Health, we look at differences in different aspects of young people's health, comparing the lowest 20% in affluence with the highest 20% affluence group. So FAS, we call that FAS for short. So just in terms of the presentation I'm giving today, that's what we're looking at. The young people living in the bottom 20% in terms of family affluence, with young people living in the top 20% in terms of family affluence. And when I present my charts, just so you can understand them better, girls are in pink, boys are generally in blue to start with the international data, and apologies for being so stereotyped there with our colours. And young people from low affluent groups are represented by an empty circle, and young people from the higher affluent groups represented by a solid circle. So I'm going to start off by presenting data just on self-rated health, which gives us an overall kind of composite measure of how young people view their own health and well-being, which would incorporate both physical and mental aspects. I know this graph on the left is relatively difficult to see probably on your screens right now, but basically you can see the range of countries, 45 countries who are included in the report. And it's a dumbbell chart, so it compares the bottom 20% with the top 20%, as I said, and the length of the lines, the pink and blue lines, basically represents the difference between those two groups. So it shows the level of inequality across all of the countries. And you can see that for self-rated health, we have fairly consistent social inequalities across the majority of countries. Now I'm going to zoom in a little bit to the top of the chart. And here you can see these are countries where self-rated health, and this is a percentage of young people reporting excellent self-rated health. And the top of the chart is where there's a higher prevalence amongst higher affluent groups. But it also is organised by level of inequality. So what you can see is that England appear right at the top of the chart. So they have the second, young people in England have the second highest level of inequality in relation to excellent self-rated health. Scotland and Wales are slightly further down the chart. So in England, for example, 44% of girls living in high family affluence, who are in high family affluence groups, report excellent self-rated health, compared with only 15% in the lowest group. So you can see this marked social differential in how young people perceive their own health. Another indicator that we look at is multiple health complaints, and this is a composite measure which includes 8 different dimensions, including both somatic and psychological complaints. So things like stomachache, headache, but also things like feeling low, feeling irritable, and sleep difficulties. So multiple health complaints means that young people are reporting at least one of these, more than one of these complaints, and more than once a week. And yet again, here we can see there's fairly consistent inequalities across many countries. But zooming in at the bottom of the chart, and it's at the bottom of the chart because here we see a higher prevalence amongst the lower affluent groups generally. So you can see, compared with the HBSC average, that young people from the low FAS groups are more likely to report multiple health complaints, and those from higher affluent groups are less likely to report multiple health complaints. And again, I just wanted to highlight the fact that the UK countries are really right at the bottom of the table, so have some of the highest levels of inequalities when it comes to multiple health complaints. So Scotland has the highest level, followed by England and Wales, ranking 5th. If we dig a bit deeper into some of these specific areas, then this is the percentage of young people who report feeling low more than once a week. And so we know there's been an increase in this sort of subclinical mental health concerns that in recent years, and many schools are telling us that they're dealing with more and more of these issues amongst their young people in their schools. So this again just shows the difference for boys and girls from low FAS versus high FAS groups. And on the right hand side, you can see the HBSC average overall. So one in 5 young people across Europe and North America say they feel low more than once a week. But you can see from the green bars, which are our low affluent girls, that much higher levels, there's much higher levels of reporting, both in Scotland, England and Wales, with up to a third of young people, young girls from poorer backgrounds reporting feeling low more than once a week. And that's much higher compared to girls growing up in higher affluent families, and there's a similar differential for boys, so levels are lower overall. And again, if we look at sleep difficulties, so this is an area where we've seen increasing problems in recent years amongst young people more generally. And I know there was a few comments in the chat earlier on in the week about issues around sleep, and it's an area that's been hugely impacted again by lockdown as a result of the school closures. So there may be some time to recover normal patterns of sleep, and it has a big impact not only on health and well-being, but also on things like engagement with school. So it's a really important area to understand and to think about how we can support young people as they recover from the pandemic. So overall, we see that around 1 in 4 adolescents are reporting, and this is pre-pandemic, reporting problems, regular problems with getting to sleep. But again, we can see really high levels of inequalities in the UK, with England, Scotland and Wales all ranking high. So Helen, you've popped up, so I'm going to have to rush through the last few screens. I wanted to mention also school experience, because this is another area where we do see marked inequalities. We see very high levels of schoolwork pressure in young people in the UK, less in terms of inequalities, but there are marked VAS differences for boys in Scotland. But it's important to note that young people growing up in disadvantaged circumstances may have fewer resources to help them manage that stress. One of the things we know can help young people with managing stress is support from teachers and classmates. Again, in the UK, we fare on average, around average compared with other HBSC countries for teacher support, but very low in terms of classmate support. And we also see marked inequalities both for classmate support, particularly in Scotland, less marked inequalities around levels of teacher support, which is a positive finding. And just finally, a couple of slides to finish on, because I think it's important to understand how we can use our knowledge to help inform what we do to support young people post-pandemic. So here we're looking at relationships between aspects of school life and mental well-being, so measured by multiple health complaints. And you can see in green, the factors in green are protective factors. So if you like school a lot, if you have high levels of teacher and classmate support, you're less likely to be reporting regular health complaints. And conversely, high school pressure, high academic expectations from teachers and parents are particular risk factors, and especially for girls. And similarly, within the family, we've got communication and support at home is also really important. And I wanted just to highlight the importance of having a trusted adult, because that was something that was mentioned by young people yesterday. And young people who don't have anyone they can talk to about problems that they can trust are much more likely to report health complaints, and that's particularly seen in older girls. So just to summarise quickly, I think HBSC shows us there's very clear inequalities in child and adolescent mental health, and also in the risk factors for poor mental health. So adolescents growing up in low affluent families have poorer self-rated health, more frequent health complaints, they feel low more often and experience more sleep difficulties, and they perceive lower levels of classmate support and other aspects of social support which are important to them. So although the evidence so far doesn't really make it that clear to what extent there's been different experiences of the pandemic across these different social groups, I think the concerns are that it may have exacerbated existing inequalities, and particularly in terms of recovery, there may be a longer process ahead for some of these children who are growing up in more challenging circumstances. So thank you very much, and I'll just leave you with some acknowledgements for the rest of the team.
Thank you so much. I'm so pleased you were able to actually provide the presentation in the end. It was such an important body of work, and lovely to see it across regions as well. And lots of really important food for thought as we think about how we're going to support the kids going forwards. Great, so we'll move on. We're a little behind time, but apologies for that. So it's so great to have so many amazing speakers. Our next speaker is Dr. Johnny Downs from King's College London and the South London and Maudsley NHS Foundation Trust, who's going to talk to us a bit about digital opportunities to improve access to CAMHS and how we might support young people's mental health going forwards. And Johnny is a consultant child and adolescent psychiatrist and senior clinical lecturer at King's. So I'll pass on to you, Johnny.
Lovely, thanks very much, Helen. So I first thought I'd just orientate you to the sort of CAMHS pathway. So this is how children and young people sort of access and engage CAMHS services, and where I think some of the, I suppose, low-hanging fruit, or what would be useful in terms of a digital strategy for taking all of those things that Cathy and had sort of spoken about and embedding them into clinical care. So just to sort of recap, really, obviously you need to have your needs identified. Young people can do that themselves. Often it's a teacher or a caregiver, maybe a social worker, identifies a need. And as Tamsin previously has discussed, is that level of probable identified need has increased from 1 in 8 to about 1 in 6 young people within the UK. Once that happens, you then need to do something about it. If it doesn't look like that need can be particularly answered within your easily accessible social structures, then you need to get referred to a service. So school counselling provision, or maybe a local youth support agency, if those needs can't be met, then generally you reach a sort of threshold that people say, let's go to CAMHS. Last year, so this is just taking figures from a couple of years ago. So in terms of the closed cases in 2019, so pre-pandemic, CAMHS received about 1.15 million referrals and dealt with that administratively. Now they're big. So when needs are being identified, and it is an effort to actually go to a GP or to get your teacher to write a referral to CAMHS services, we then start to get lost. So these are individuals that have an identified need. Someone's really made an effort to seek help. We then lose about 26% of that group that get turned away by child services for lots of different reasons, which I've sort of listed there. Then they move through to an assessment. The assessment itself, we then lose 19%, from that original already attenuated group, don't get past that first point of contact. So again, they sort of get turned away from need. Still, there is a need there, but it's not meeting these particular thresholds. And then when we get referred to treatment, and of which we often know there's quite protracted waiting lists, what we're tending to find is that we've got quite a big chunk of young people really don't even get to the point where they're accessing regular treatment. So we're getting about 50%, so 23% are actually not turning up to 50% of their assessment. And also in terms of understanding systematically their improvement, we know that we don't really systematically collect a sort of outcome measure. So being able to really track whether young people are symptomatically improving using these different measures. Okay, that's the scenario as it stands or has stood in CAMHS. And I think that picture has been fairly consistent for years. So what can we do about it? We can't rapidly increase the CAMHS workforce. We're struggling to do that. Ideally, that's what we should be doing, getting more people on the ground. But we've got an urgent need, and we need to do something that tries to answer some of that need. So the question is that can digital approaches certainly enhance the approachability of and availability of evidence-based CAMHS provision? And I think that's stuff that Cathy was alluding to in terms of population-based provision, universal provision. And then can we also then embed that within our clinical care? And then secondly, can we enhance the ability of young people, A, to sort of perceive their need, reach out for support and actively engage in care? So when we talk about digital, we often just think of apps or some virtual reality stuff, but the digital encapsulates the things that we do in terms of understanding people using currently existing digital-based systems. So this is routine survey work or routine data acquisition for public services. So one thing to do is that when you're thinking about providing universal or pushing resources into a particular area, it's like, where do we go? Because it's not always straightforward for a local authority or for a health trust to really understand where the needs are within their population. So this is just an example of taking advantage of existing data sets and bringing them together. On the left-hand side, this is a funnel plot where the little blobs are primary schools, and it gives an indication of the primary schools that have very high rates of referral. So we're able to garner from our existing digital assets who are the schools that seem to be asking a lot for CAMHS support. That can then help you think about where do we direct the need, or also conversely look at those groups that don't seem to be referring very much and try to understand why that is. Is that to do with their sort of helplessness and not able to engage, but there being population need? Or is that actually to do with that they're actually able to, the need within their population is quite well managed? On the right-hand side, this is the graph focuses on adolescents. And this is looking at again, looking at schools, secondary schools, and how the self-harm is distributed, attendance to accident emergency self-harm is distributed amongst those schools with rates varying. And as Cathy pointed out briefly, is that there's quite a lot of, there's massive rates, and there's part of the Children's Commission's report, there's massive rates of differences across different trusts in terms of those that get access to services. But within a trust and within a population, there are big inter-trust or inter-region differences in terms of areas that are accessing care. So some schools, for example, have good rates of CAMHS support provided to them and some less so. So what do we do? The first thing is to think about how do we understand the population need? And this is again just a digital example, one digital example, but lots of people are doing this type of work where we take advantage of the fact we've got near ubiquity of smartphones amongst our adolescent population. So we're 96, 97% in the Ofcom report. Young people don't like answering links very much. This is the feedback that we got from our qualitative work, clicking on links and going to various web apps. They like to have an app on their phone. So this is just a method of surveying routinely young people that we've tried in schools. And then within that, you can then start to give links in terms of improving their access and accessibility within universal services, is that you can signpost to a particular service like Kouth, or you can actually signpost to individuals within the school, like a place to be counsellor that actually sits within the app. So this is just a way of enhancing how you collect data, processing that data to understand the population need, but also providing something that the young people can have that can actually enable them to access help more readily. The second thing is obviously, so that's just sort of an example of maybe enhancing universal provision. We do know that our rates of help seeking, our CAMHS referral rates, are going to increase. We know that. So this is from last year. This is just following the dots. So this is pre-restrictions. We then had a dip over the restriction period, and then we've had a steadily climb. This is data from my trust, a steady climb in referral. So a 40% increase in what we had previously in terms of rates of referral to our services. So we know that there's quite a lot that is going to, a lot of demand that is coming, and I think our CAMHS services are bracing themselves for that when schools kind of return. What we found is one way is it's what's quite difficult is if you just put a resource out and just say, please everyone use it, people don't tend to pick up on that. One of the best ways to really get people to use sort of psychoeducation tools or digital tools, etc., is to make them targeted to the needs that they have. So you need to do some understanding of through a survey approach possibly, of understanding what are their discrete needs, because not all mental health problems are the same. And again, as Cathy pointed out, is that some sort of attention difficulties, etc., may be more prominent within the populations that are seeking CAMHS support at the moment. So this was just a tool that we used to rapidly survey those that were referred into our services, to get them to complete just simple text message links sent out to parents to get them to complete surveys. And then that allows us to port into a particular digital therapy whilst they're on the waiting list. So we've got that big chunk of our group that are on the waiting list to then receive some therapeutic support whilst waiting for their assessment or for further treatment. I'm not going to cover all the potential digital interventions. There's a lovely accessible article by Bethan Davis provided on the ACAMHS site, which I've just added a link there. But then what you can do is that you understand the need, you can then signpost to those services that may be more relevant. I'm just going to end on this note, which hopefully sounds a little bit optimistic. So what we've obviously had to do in CAMHS is convert from face-to-face to essentially remote working. And we will still do not understand the consequences of that service change. Are we capturing the needs in the right way? Are we going to see a sort of a deterioration for those kids that have maybe received that or just a different type of care provision? So clinical services are quite difficult beasts to change. It's quite difficult to get people that are embedded in working in a particular way. But this is just an illustration in terms of how CAMHS services has converted quite well from face-to-face to remote working in terms of the contacts that they've been made. And then this is the graph on the right-hand side, just looks at consultations and its distribution of phone and video, where you can see at the top, pre-pandemic, no video calls were made. But now we're starting to see a gradual sort of, I suppose, digital competency or confidence amongst our workforce in terms of being able to use these video contacts, which I think you get a better sense rather than using phone contacts. So we've got some sort of increase in being able to operationalize our video conferencing use in services. So what the hope is that the more digitally articulate we get, the more we're able to support these other digital interventions, whilst we're also trying to build our capacity within our workforce. So I'll leave it at that.
Perfect. Thank you so much, Johnny, and so important to hear from a clinical perspective how that's going, and just the amazing work you guys have been doing to suddenly move online like everyone else in a very difficult time. It would be interesting to see how that pans out, and if we can have more flexible provision in the future. Okay, so I'm going to pass on now. We're very delighted to have two commissioners, Children and Young People's Commissioners, with us today, and the first one is Koulla Yiasouma, who I'm definitely haven't pronounced correctly, so I apologise. Who's the Northern Ireland Commissioner for Children and Young People, who's going to provide us with a Northern Ireland perspective on building back fairer for children's mental health. So I'll pass over to you, Koulla.
Thank you very much, Helen. And I suppose just to sort of pay tribute to Sir Michael, who started this, that we're very taken by this notion of building back fairer. And what the pandemic has taught us is it's highlighted the chasms. So anyway, so here, so just a bit of context about my my title. So very, very pleased to be here. And today is going to be more about broad brushstrokes and then some of the detail you've already heard. And now my screen won't move. Oh, here it is. So I'm just going to give you a quick trot through some of the systemic issues that we've seen in Northern Ireland, but pre and post pandemic, pre and during pandemic. We're not post yet. That's me being an optimist. As it relates to children and young people's mental health and well-being. You can see there that mental health and emotional health of our children and young people has been an issue. It was an issue when I became Children's Commissioner, and was an issue in 2015, and it was an issue before then. And I know that that's the case across the United Kingdom and these islands in the Republic of Ireland also. So just very quickly, in 2018, we published this report, Still Waiting, and actually Johnny's presentation just before mine, you know, we address some of the same things. We work to try and understand young people's journey through the child and adolescent mental health system, and found some of the issues that you've heard being spoken about before. We made a set of we made 50 recommendations across 8 areas, which you'll be able to find on our website. It talked about how quickly young people can access help, how seriously they're taken, whether GPs are the best pathway through to CAMHS systems, the importance of a trusted adult, the importance of training for adults who work with young people in universal settings, in order to do, you know, the first aid, the early intervention. The importance of having smoother transitions between children's services and adult services. And then the very specialist support or young people with additional need, particularly those young people with learning and intellectual disabilities, that sometimes that young people are funneled either into one system or the other, but the ability to address the mental health needs of young people with learning disabilities has been found wanting, as has those young people who use or misuse drugs and alcohol, and again they get channeled into one or another in Northern Ireland. We published, as I said, in 2018, and one of the things we're determined not to do is the and what, is not to ignore the and what. So what we've done since 2018 is we've monitored the implementation of our recommendations, and our government has set up an interdepartmental working group, and I'll talk about how that's been embedded into some of the more widespread. And we've just published last month our second monitoring report on effectiveness. I'll leave you to judge, if you have time to judge, what that looks like. One of the main recommendations we made was the importance of actionable data. And again, you've seen today information on prevalence of children's mental ill health and emotional wellbeing. Well, in Northern Ireland, we had our first prevalence survey published in October of last year, although most of the fieldwork was done pre-COVID. Here are some of the highlights, and if you can call them highlights, but here are some of the big messages, and some of the others include that 18% of 5 to 19-year-olds were found to have a diagnosable mental health condition in that survey. And then pulling out on the themes of today, When we compared, when rather the researchers compared the 20% most deprived areas against the 20% least deprived areas, as you would expect, as you've already heard, there were higher overall rates of emotional and behavioural problems in the least deprived areas by 16% versus 7% for emotional behavioural problems, 18% versus 10% for emotional problems, and 13% versus 6% for conduct problems. So again, just reiterating what you've already heard about across the water. Not going to do the whole league table thing. Well, I am actually. I've just said I'm not going to do it, but I am actually going to do it. Northern Ireland as a society emerging from conflict and the trauma of conflict, and the fact that it still rears its ugly head consistently in the lives of our young people. We're still experiencing higher levels of mental ill health than anywhere else on these islands. And also reiterating the point that's been made about younger children and earlier years, that our family support services are finding that greater levels of referrals for primary school children. During the pandemic, because I'm speaking 10 to the dozen and trying to get this done, during the pandemic, and I've learned actually never to keep Sally Holland waiting. So during the pandemic, there's been some survey work, and quite interestingly, we've seen a real upsurge of young people themselves campaigning on these issues. And here we have the Secondary Schools Union of Northern Ireland did a survey of 2,000 secondary school students in December, between November and December. They themselves decided to go out and find for themselves. We have another group in Northern Ireland called Pure Mental Health, which again, Pure Mental NI, which again is run entirely by young people. This has been a huge campaigning issue for young people. Again, you can see there from the Mental Health Matters survey how young people are concerned. And I do want to very quickly raise this issue about schools, particularly for exam years and GCSE and A-level years. And for us, the last year of primary school is also considered an exam year because we have academic selection and they do a test. That's a whole different lecture that I'm very happy to wax lyrical about at another time, and what that's done to our wee ones is heartbreaking. But anyway, the uncertainty around exams, the determination around assessed work and course and controlled assessments has meant that young people between the ages of 15 and 18 are completely stressed and anxious. And indeed, as discussions have begun about returning to school, this year group are going back on the 22nd of March. Some of them have already been written to by their schools and have been told their first week back in 2.5 months will be a week of controlled assessment. Their first week back, when these kids are telling us how anxious they are, how worried they are, and what they're doing is heads down. They've been told to spend the next 2 weeks studying and heads down as soon as they come back. So I don't even want to think about how our mental health, the referrals and the tsunami coming ahead of us is going to look like. So what we have, so I do want to talk about the way forward, because we are hearing, as I've just shown you, anxiety around school, loneliness, social isolation, and social phobia, and worries about that and outcomes. And then we have our children, as I've said, children with disabilities, huge concern. So there's some sort of big picture groups, and underneath that and cutting all of that is the fact that young people in economically and socially deprived areas are getting a bigger impact. I can see you, Helen. So we have published our children and young people strategy, and there you can see our lovely outcomes, which give us a warm fuzzy feeling throughout. What the pandemic has taught us, and I've been watching the budget, what the pandemic has taught us is the fragility of our systems and the fragility of the lives of our children, particularly those living in socioeconomic vulnerabilities. And where I get some heart from is that the discourse around poverty has changed. I suppose going back to what Sir Michael was saying earlier, I think we've gained some understanding as a community around the deserving and the undeserving, the strivers and the skivers. And what I hope is we can keep that narrative to make sure that we do build back fairer. So there's not much, there's a lot more I can say. I've got several pages, but I'm not going to bore you with. Like I said, I've learned over the last 6 years never to keep Professor Sally Holland waiting. So thank you for listening to me. And I do have to jump off at 5 to shout at a minister. So thank you very much. It's been a really
Thank you so much for your time, such important words. And I think, you know, presumably you're posting your website on the chat for people to go to access some of this, and I think Andre has as well. And I think it paints a depressing picture, but I think it also provides us with so many opportunities. And as Cathy said, I think that there are so many things we can do, and I think that's what we need to focus on. Great. So if you don't mind, just stop sharing your screen if that's okay. And I'll pass on to our final, but definitely not last, speaker of the day, who is Professor Sally Holland, who's the Children's Commissioner for Wales, who's going to tell us a little bit about what all young people need to support their mental health as we emerge from the pandemic. So I'm going to pass quickly on to you, Sally, if you're all right to start.
Thanks so much, and it's always a delight to come after Koulla, and it's the most succinct I've ever heard her, so well done, Koulla.
I'm going to just get you to put it on the full presentation mode if you're able to.
Yes, of course. I can't get
to enable editing, and then
yeah, I just can't get, there's something over that bit of the screen, a bit of zoom.
If you click down in the bottom right hand corner, Sally, on the orange bottom right, there's a little picture of a screen down there on that orange bar at the bottom. If you go on the right hand side, there's a little picture of a screen. To the right again, a few more icons. Just to the left of that, there's a screen. If you click on that.
Sorry.
Not that one. Go to the right. That's the one.
Yeah.
That one there, yeah.
Thank you.
There we go.
Sorry about that. Yeah. Okay, that's a new lesson for me, IT lesson, thank you. I'm going to try and do two things. I know we're a bit short of time in this presentation. I'm just going to show you the highlights from what we've heard from tens of thousands of children, young people about their experiences during the pandemic. But secondly, talk about what I think that means for what we need to do next. And I hope to share two related and I think exciting policy developments in Wales that I think will speak to people across the UK as to what we need to do next. I have to say I was just really shocked by what Koulla just said, and someone put the chat about children returning to controlled assessments. We've been very clear, the results of our surveys show that the emphasis must be on well-being, socialisation, play when children return to school, and the learning will come after that. And I'm pleased to say the government's taken up those messages and given them to schools. So I want to talk to you about the survey we've done. We've done two surveys, both in the height of lockdown, one in May last year and one in January this year. We had a huge response. About 1 in 20 children and young people in Wales responded to both surveys, 24,000 the first time and 20,000 within 8 days the second time. And they all had different ways. They were aged 3 to 18 and had lots of different ways of responding, but they all covered similar themes so that we could compare responses. And I'm sure we'll share in the chat the link to the full results. But just to give some highlights from the January one, really seeing from children and people some real frustration and anger about how long everything had gone on and not seeing an end to it. We asked we didn't ask in May, we asked this time because children put it in the comments the first time around about loneliness. I'll share some loneliness stats with you. And in the qualitative responses, there were open answered responses to the top message from children and young people was, the most common response was to talk about mental health concerns. And I also I don't have time to show you today, but it's in our report that, as I'm afraid you might expect, children who have trouble getting their rights before the pandemic have continued to have that problem during the pandemic, and they've reinforced those issues for children from Black, Asian, minority ethnic backgrounds and for disabled children. Okay, So just first of all, to show you some of the feelings children have been having, I think we expect, you know, that the experts on the panel today will show that you will know that from their surveys that children from primary school tend to be a bit more optimistic and positive about their lives than children in adolescence, and that those patterns are shown in our surveys. But what I want to go on to show you is the real differences we saw across the age range, particularly amongst adolescents. So this is from from our January survey, and these are our positive emotions, feelings that children were reporting, and just those who responded most of the time as their response. So children feeling safe most of the time. We see a linear decline in that. That's the blue, and the pink is those who feel happy most of the time. And that happy most of the time does decline from 50% of 12 to 18-year-olds in May to 39% in January. And here are the more negative emotions. And I just want to draw your attention to the pink one in particular, which is children who said they felt lonely most of the time, not just some of the time, but most of the time. And that rises up to 40% amongst 17-year-olds, with no difference actually as to whether they were an only child or had 3 siblings. Because what we know, of course, is that, you know, in your adolescence, you want to be with your peers, and you feel lonely without your peers, and actually having some annoying siblings in the house doesn't always help with that. Amongst primary school children, being an only child did give them an elevated risk of feeling lonely most of the time. And here's just a couple of quotations. We've got thousands of these, and we read and coded them all within a week of getting the data in January. All of this data has been shared on a data sharing agreement with Welsh Government, and they got access to data before as the survey was even open, and as soon as it closed, to help inform their decisions about reopening schools in particular. And having said they wouldn't have the younger secondary school pupils in before Easter, using this data and putting behind the scenes pressure on them, we've been able to get them today to announce that all children will have some chance to go back to school in Wales before Easter, with an emphasis on well-being and socialisation. We also asked them about confidence, to get help from places. Friends and family, by far the most popular. The pink is yes, and the green is no, with just under 50% feeling confident to get help from other places like a mental health team or school counselling. School counselling is a statutory requirement in every school, in every secondary school and the top end of primary school in Wales. So they should have good familiarity with accessing it, and it has been available throughout the pandemic online. And play and relaxing. In May, lots of them were saying they were actually doing more because they weren't in school, the weather was lovely, and children were enjoying spending time with their families. But I must emphasise, some children have had really good experiences of doing lots of new things and spending time with their families during the pandemic. In January, fewer were saying they were relaxing or playing more, less than half than before the pandemic. So what needs to happen next to support our children and young people coming out of the pandemic? I just want to share 2 developments in Wales that were happening before but are escalating now since the pandemic. And I was late today because I've just been with regional leaders from every region in Wales and our Minister for Mental Health and Minister for Children, hearing about progress in these areas. And I'm pleased to say everyone is committed to these agendas. The first is they're responding well to our request that they must have a no wrong door approach, so that children stop falling through the net if they don't have a medical diagnosis, or if they don't have enough of a problem to have statutory services. And we're saying that whatever point children come in to seek help with their families, and we must make sure we have a joined up response, so they're not knocking on lots of doors and being told they're queuing up at the wrong door. Several regions in Wales have now brought in a really joined up response, so that within a week of a referral, they're contacted by a professional who will discuss the range of social, youth, educational and CAMHS services that might be available and work out with them which is best for them. And I'm really urging the other regions to do the same. So we're making some real progress on that, and everyone's using now the term no wrong door in Wales as to saying what they hope to get to, although they still have some way to go. I'm monitoring their progress very closely on that. And as part of the no wrong door, the government has worked hard and has agreed to implement a whole school approach to mental health and well-being. And that statutory guidance is coming out at the end of this month, which means all schools must have a plan to have a whole school approach, which will be both universal and targeted support for children and young people. They will have close links with our mental health teams locally and other services in the voluntary sector, at social services, etc. We must have a coordinator in school, and every health board area must have an implementation lead to support that whole school approach. And they'll be given an evidence-based menu of options for programmes that they will be supported to access freely throughout Wales. Some of those things aren't quite ready yet. That menu isn't quite ready yet. But I'm really pleased that we've got this coherent approach now. It's easier in a small place like Wales, and we don't have academies. All the schools are local authority, and we don't have any market split in our health service. So again, it makes it easier to implement things, I think, altogether. But I suppose from my meeting this morning with all the regions, I think the good thing to say, positive thing to say, is that they're all supporting this agenda. We've all got a long way to go, got the same issues as everyone else in the rest of the UK, but they are willing to do it, and they are all, with our urging, now got ways of listening to children and young people and their families' experiences systematically, so they know whether they're succeeding or not. So I hope that's quite an optimistic end, and really happy to share more details about that with anyone who wants to know.
Thank you so much, Sally, and just amazing to hear about all the things you're managing to achieve in Wales that the rest of us in the UK could definitely learn from and really should be implementing. And thank you both to the commissioners for the amazing work that they're doing, and thank you to all our speakers. I'm conscious we're nearly at time, and we're going to run over a little bit to make sure we have time for the panel discussion and just get some thoughts from parents, carers and a young person. And just quickly before we pass on to that part and final part of the session, I just want to flag that in the chat, we posted a link to a Slido live poll where you can put in a key takeaway from the message that you've taken from this session or from other sessions in the conference. So please do that at slido.com, and the code is 87437, and that will be in the chat. So I'm now very, very swiftly going to pass to our panel discussion, and we'll try and spend about 10 minutes on this. So please do stay with us over time if you can. And really excited to have several people with us today. So if those people want to turn on their cameras, if they feel comfortable doing that. So we've got Cathy, who's a carer and doing so many different things. So a co-RE advisory member, a PhD student, LSE, studying unpaid carers with experiential knowledge of mental health, and a member of the Lived Experience Advisory Group at the Centre for Society and Mental Health as well. So thank you for all your amazing different contributions. We also have Ashley, welcome Ashley, who's a young person involved in the Keep Cool project at King's College that we heard about a bit yesterday. And also we've got Caroline, who's a parent and also a registered childminder, and Catherine or Kat, who's a parent. I think that is all of us. So I just guess in our sort of final sort of 10 minutes, the question I wanted to kind of put to you was, we've heard so many different things from academics, from practitioners, from commissioners about the challenges facing young people in this period. And what I'd like to ask you is to tell us, what do you think we need to do to support young people during the remainder of the pandemic and over the next few years to make sure they are healthy and able to thrive? So any thoughts? Who would like to go first? Cassie, do you want to start us off?
Yeah, absolutely. I think the first thing we need to look at is a tailored approach to different types of young people, because especially throughout the presentations earlier, we focused a lot on sort of young people as this big homogenous group, but it's not really like that. I know from my research on carers, There are a lot of young people in that situation who are really scared to go to school in case they bring the virus home for the people they support. I think is a really good example of how we need to consider different types of young people. I think in the same vein, we need to look at young people who are shielding, so have been at home the entire pandemic. And a lot of the research mentioned previously talked about young people who have been having more time to spend with their friends, even if it's online, or spending more time with their families. And that's not always accessible to disabled young people. I think that's a really important point. In terms of moving forwards in education, I really think it's about taking the learnings we've had from the pandemic. And we focus so much on how difficult it's been, but a lot of really useful techniques have come out of how we've taught during the pandemic, along the lines of having more flexible deadlines and recording in university level lectures and seminars, but also in young people in schools, recording lessons so people can look back on them when they're revising or learning for exams, things along those lines. Online or like digital study sessions as well. A lot of young people that I've spoken to have found quite helpful and would be a really good thing to keep going moving forwards from the pandemic. So we've seen that it's been a really negative experience, and not to take away from that fact, there have been a lot of positives that I feel like we should be looking into improving moving forward.
I think you're right. There's so many different things we could learn, isn't it? And it would be nice to move some of that, what's useful in this period, forward to make things more flexible for people. Ashley, do you want to tell us a bit about what you think will be important for supporting young people going forwards?
Hi, yeah, so before this conference, I got a question about how do young people feel about accessing mental health advice online? And I think a really key part of that will be finding ways to reach out to young people that in a way that they can trust the source that they're going to. I think I think it was somebody who spoke today mentioned a lack of trust from being told they've come to the wrong door, and they've gone to get support and they've been told, oh, you're not sick enough yet. And that's really damaged, I think, a lot of people's trust, especially in educational institutes, in being able to go to them to get support. And especially online, especially with how much stuff has been made during the pandemic. There's a huge opportunity to really have like a new way to outreach, but it will be about making sure that it's getting to the right people, they're finding it and they can trust it, and then it's useful and targets the right issues and targets different people and different ages really like successfully.
Great, thank you, that's fabulous. Kat, do you want to come in with your thoughts from your perspective?
Hi, yeah, a lot of what's been talked about today has been based on kind of young people, adolescents, and I'm coming from as a mother of a 5-year-old and a 2-year-old. So for me, when I think about my children's mental health and how they can be supported throughout the rest of the pandemic and as we come out of it, it's about what the schools do, about not focusing too much on learning and catching up, and just playing and possibly bringing in forest school practitioners and artists and theatre and working more on the social kind of and the emotional aspects. And for my 2-year-old, I didn't think it would affect him quite so much, but actually it really has. And I've already seen kind of a decline in support and activities for his age group since when I had my eldest child. And I'd hate for it to decline even further. Now there's no kind of play groups at the moment. I think it's really important that a priority is put there to help younger children as well.
Yeah, I think so important, as you say, across all the age ranges. We have focused a little bit more on that older age, but as you say, if we can really support the very young children going forwards, it's going to make a huge difference to a large portion of their lives going forwards, isn't it? Really, it's going to make a big difference. And I like that idea of the kind of the anti-testing of kids as they come back straight to school, which sounds horrendous, but bringing in those more creative approaches to help them get back into socializing and thinking in quite a different way. Great. Caroline, do you want to come in at all with any thoughts from your perspective about how we might support children and young people going forward?
Yeah, it could get a wee bit noisy here. I'm just coming as well as Catherine from a parent's perspective, also as a child care provider. I think it's important that we listen to the children and the parents. Low income and we've discussed it throughout, is a big factor, especially in rural areas. You know, it's important that we support parents, that we can get them children out and about. When you're in a rural area, it's a real struggle sometimes to get your child out into the countryside, out somewhere where it's peaceful, so that you can have that opportunity to talk to your child. Because as a parent on a low income, my child sees me stressed and worried about low income, so she won't talk to me about her worries because she sees my worries, you know. And it's a fine balance, really. I do think it's important that we support parents as well through that, you know, so that we can adequately support our children through their mental health experiences.
Yeah, absolutely. That's a kind of whole systems approach, really, isn't it? So the parents as well as the children and the teachers and everyone else in the community around them, really, isn't it? To make sure we push that as far as possible. And I think that's a really important point. Sorry, carry on.
No, you're okay. Go on ahead.
Okay, I'm just going to pick up with the other people on the panel as well. Are there, what you were talking about there, Caroline, was a need to focus perhaps on certain groups in society and people who are vulnerable and disadvantaged. And I wonder what Cathy or Kat or Ashley thought about whether actually some of the things we need to do to support people, whether they are going to be the same across everyone, or whether actually different groups of people might need different types of support. I don't know, Ashley, if you've had a think about that at all.
Yeah, I think that's going to be huge. I think the socio-economic background is definitely going to be probably one of the biggest indicators on you know, what kind of experiences people have had. But I think definitely, like you say, sort of school age, the GCSE kids who've had lack of exams and exams come back in, and it's been very chaotic, and they've gone through real periods of being like, you're going to be under huge stress, and then there's no structure, and that kind of changing is going to be completely different to the experience of like a university student who's living independently and has control in that sense, but you know, is now looking at a job market that's looking slightly bare. And you know, the primary school kids who have, you know, a parent who's working full time, also trying to manage them, and there being, you know, like a whole different kind of lack of structure. And Cathy, I think you were saying, you know, even more specific than that, there are going to be very specific groups with really, you know, like key needs.
Thank you. Kat or Cathy, do you want to come in on that at all?
Yeah, I completely agree with what's being said around there are very specific types of people which need specific types of support for their needs, because we talked a lot about things like moving forward in the future and unsecure job markets and things like that, and I think that's really important. But it comes down to this sort of, we can't ignore the social determinants of mental health and the social determinants of someone's well-being, which is poverty, and if their parents are working, and if you are taking care of your younger siblings, for example. Like, there's so many ways in which people are not, like, people are different from what we expect when we create mental health resources, when we put things in place to support people's mental health. And unless we try get in touch with people which are in those areas, those are the people which will suffer most in the long term of this, whether it's within the digital divide and people which don't have access to the internet, or if they do, they only have one device in their household, or whether it's people which are managing their time between like two parents which are in a divorce, things along those lines. Or I think especially important to this conference is young people in transitional periods between CAMHS and adult services, who already we know just get dropped because they age out of one but haven't aged into the other yet. And moving forward, we definitely need to consider that group of people who are already vulnerable to this, who are already suffering, and then they're just being sort of left on their own. And I think it's completely unacceptable and really concerning. And where we do put resources in place and try to help young people, we have to consider those groups of people.
Absolutely. And I'm gonna pull it to a close there, and I'm sorry we haven't had a huge amount of time for the panel, but just some really important points there to finish on, and really thinking about how we can take all of that into account, what we've heard today and in the other days of the conference, to really help us think, how do we want to move forwards. And these talks are being used in for the rest of the week in a policy lab, bringing together different people involved in that to really help us move the dial forwards on how we support young people going forwards. So I just want to take this opportunity to thank our fabulous panelists here. Thank you so much for your time and insights, and all of our amazing speakers who've provided such a wonderful array of talks across today, but also the other 3 days of the conference. Thank you so much for giving up your time. Just a reminder that this webinar and the webinars from all 3 days are available on the Mental Health YouTube channel, which I think has been posted many times in the chat. You'll also be able to see the slides and presentations on the Emerging Minds website and the Centre for Society and Mental Health website from later in this week, I think. So just a huge thank you to everybody, and particularly behind the scenes as well, who's done an amazing job of really pulling all of this together, and Mental Health and on all his team for making sure we get a wide appeal as possible. And I'm just going to very, very quickly finish with 2 plugs. One is for another conference which is being held by the ESRC Society for Society and Mental Health in a bit later in March, looking at social change, inequality and mental health, and with a really wide array of both academics, but particularly young people, community organisations, and lots of creative aspects as well. And that's a free conference, so please do check that out. There's also MQ, which is a mental health charity, doing a conference in May, which is also online, and will include some work on youth mental health and COVID and a variety of other mental health areas. So please do check that out, particularly if you're an ECR early career researcher. We've got some great options there. So thank you so much, everybody, for coming along today, and everyone that's been involved. I really appreciate everything. Take good care and stay safe. Goodbye.